Welcome back to SGMD. Every week we're going to have this topic on the show called Colorful Conversations. We're going to get a chance to talk to scientists, medical innovators, even celebrities, all of whom are right now having an impact on your life. When it comes to healthcare, frankly, I think there's been a lot of noise on this topic and very little understanding. So we want to dig through that a little bit today, really get down to what's happening, how it's going to affect you, and how it's going to affect your wallet. I have two guests here who I think are some of the best in the business. These guys have been writing about this topic for some time and are really willing to sit down and help us dig. Dr. Darshak Sanghavi is the Chief of Pediatric Cardiology at the University of Massachusetts Medical School. He's also the health columnist for Slate Magazine. Jonathan Cohn is here as well. He's Senior Editor at New Republic. He knows the ins and outs of healthcare better than just about anyone. So as things stand now, you support the current bill.
I support the House version over the Senate version. I think both are better than nothing.
Jonathan, same for you?
Absolutely the same.
Jonathan, how might this change the dynamic between the physician and the patient relationship? Most people who are paying attention to this really want to know how it's going to impact them. Will there be an impact on that dynamic?
Well, I think on a surface level, in terms of you go to the doctor and how is your experience with the physician different, you won't see a lot changing. You will still be able to pick your doctor as much as you could now. If the insurance expansion works, and I believe it would, you'll have an easier time getting to the doctor, you'll have an easier time paying your bills. And I think that's important to remember when we talk about the doctor-patient relationship. For so many people in this country, financial barriers to care change the way they get medical care. You know, you go to the doctor and you get a prescription, and then you don't fill the prescription, right? Or you don't get the follow-up visit because it costs too much. Well, we won't see that happening as much anymore, so that will change.
With pediatric cardiology, my guess is there is a lot of art to what you do, yes, as well as science. This idea of comparative effectiveness, trying to figure out what works and pay for those things. Yes. That may sound great in principle, especially if you're talking about like economic principles, but when it comes to medicine, things that you may do that don't have definitive proof that they work, are you willing to say, you know what, let's stop doing those things?
I think this is really the key for what actually scares a lot of Americans about healthcare reform. I think that in medicine, as both of us probably know, there's things that we know definitely work. You know, nobody argues about surgery for appendicitis. Mm-hmm. On the other hand, there are things we're not so sure about. You know, certain types of heart procedures for if you have chest pain. We don't really think those really help people out, and there's a tremendous amount of variation in practice. I think what comparative effectiveness research could do in a